My name is Marvin Malik. I'm the course director of the Northern New England Health Policy Internship Program, and this recording will be an introduction to the rules and concept of high deductible health plan linked to health savings account, which is a major policy of especially proposed by economists and generally a major initiative from the Republican Party in the United States. Without further ado, I shall share some slides. Note that this talk will tee us off to have a discussion about the expected implications of this policy for the uh, overall governmental spending on preventive care and public health and on individuals' household uh, financial situations. Okay, so we'll discuss mainstream Republican Party approaches to cost control and the identified problems in general is the notion that people have too much insurance and they need to have skin in the game to lead to more judicious healthcare decisions. In other words, do you need to run to the doctor for every little sniffle? And the implication of that analysis is that the main cause of high spending in the United States is due to too much health care. The doctors may be too likely to order tests, and the patients are too likely to run to the doctor. And interestingly, when you do international analyses, the biggest difference between the United States and other developed nations' health spending is in prices. We pay more and for everything ranging from doctor visits to prices of pharmaceuticals and to having colonoscopy. All these things are given much higher price tags in the United States. I don't mean by a little, I mean two to three, four times higher. So, but nonetheless, the policies we've seen actually from both political parties in the United States generally focus on volume. We run to the doctor too much. Another point to make is that in most other developed countries, there are actually more doctor visits per year on average. Nonetheless, we'll focus on the Republican approach to cutting to cost control through decreasing the volume of services. One idea coming from the Republican Party is that there's too much regulation, that insurance companies should be empowered to do what they want with benefit design, market as they will, and get rid of state and other regulations, getting like reinstate a pre-existing condition clause. And if people with pre-existing conditions, if the cost of that care is no longer going to be a liability of the insurance company, they can charge lower premiums. Healthcare will be cheaper. Of course, your pre-existing conditions won't be covered, but at least the premium will be lower. The other idea was that you could cross state lines and that if you could buy a health insurance policy from any state in the country, you could be a judicious shopper and potentially save money. The problem with that is that you really want to have insurance companies that actually are going to pay the claims, and it would be much more difficult for state insurance regulators to examine every single insurance policy to make sure that it can pay its claims, that it's not totally fraud. And there have been several insurance frauds where fake companies got set themselves up, marketed themselves, received premiums from people who thought they had health insurance, and it turned out they had nothing at all. Their health care was never paid for. by these fake companies. So having some sort of regulation is important, and but the idea was you could buy any policy in the whole country, even if they had terrible coverage, huge deductibles, and all kinds of clauses like pre-existing condition clause. But that's an idea, the goal being to lower premiums, but its other impacts are often not discussed, are rarely discussed. So the idea was there's not enough competition and we should deregulate, allow people to buy coverage across state lines, and you'd end up with cheaper policies with skimpy coverage. They'd maybe outpace their competitors due to lower premiums. The Republican Party generally supports malpractice liability reform. It only accounts for 1% in direct costs, maybe another percent in what's called defensive medicine, where doctors order more tests than they actually think are needed. We're in the concern due to concern about being sued. Um, and this cost actually is about 10 times higher in the United States compared to other developed countries. Would seem to be a really good idea. And anyone concerned about health costs should certainly support it. Uh, but you're not going to save that much since the total spending on this is direct cost is only 1%. I would note that it's also a very regressive form of spending since a wealthy person, one of the awards in a successful malpractice suit is foregone income due to the injury. So somebody who's poor and earning $10,000 a year, if they totally couldn't work for an entire year, they would get $10,000. Whereas a wealthy person who's suing, if they lost a full year's income, and their income is $900,000 a year, then their award would be $900,000. And the doctors pay for these policies. You can see that the award money is going to heavily go to people who are wealthy. So it's a very regressive cost within the healthcare system. Another point is that both parties support each other's primary approach. So the Republicans are not arguing the Democrats' favorite policy of value-based care, and the Democrats haven't really done anything meaningful to oppose high deductible plans. In fact, Richard Nixon's primary health reform proposal that he proposed just before he got into trouble with the Watergate scandal was quite similar to Obamacare. And here's Obamacare. These are the deductibles and copays, and you can see that if you have a bronze plan, you're actually paying 40% of the total cost out of pocket. So there doesn't seem to be any major objection within the Democratic proposal to have people paying a whole lot of money out of pocket to get their care, making them the ideal judicious consumer, but a consumer who may really avoid going to the doctor. Okay, so how do you set up a health savings account? Here's how you do it. You enroll in an IRS qualified high deductible health plan. That's a requirement. The minimum deductible is going to be $3,400 for a family plan and $1,700 for an individual. You are not allowed to have insurance plan with coverage that's any better than that. So those are the minimum deductibles. You then proceed to an IRS qualified bank and establish a health savings account. Most banks are, in fact, qualified to do this. And there are another option I'll discuss in just a second. But anyway, you and your employer would deposit money into the account. And for a family, it's a maximum of $8,750 a year, $4,400 for an individual. Interest rates in these plans are often low, and whoever is supplying your plan, if it's a bank, they can charge a monthly maintenance fee. So when this idea of health savings accounts was first proposed in the 1990s, the banking sector, it wasn't just the insurance industry, but also the banking sector lobbied heavily to put this into place, and create this structure, and that lobbying was successful. And you have alternative ways to locations, I guess you call them, to deploy your HSA money. You're allowed to set up an account with a specialized HSA administrator that may charge lower monthly fees, perhaps higher interest rates, or even with a brokerage firm. So in other words, instead of just putting the money in an interest-bearing account, you can now take that HSA money, which has not yet been taxed at all, and roll that money into Wall Street investments. Now they can go down, but on average, their annual yield is going to be higher. For somebody who's really going to depend on that HSA money for their health care, they probably aren't going to want to do that since the stock market can go down at any time, as we've seen at several points in worldwide history, including in this country. Okay, so key point is that HSAs provide a triple tax break. The money is not taxed the year you deposit it, so that's one. The second is investment earnings and capital gains and interest are not taxed the year the account earns them. So this is different from usual investments you may have if you're wealthy enough to have an investment account. Your dividends and capital gains are taxed each year, but not with these accounts. And then finally, you can withdraw money from the health savings account at any time, and it's not taxed if you're using it to pay for health care. On the other hand, if money is drawn at a later time and it's not used for health services, then at that point you finally pay taxes on this money. But if you spend it on health care, it was never taxed at all. So compare that to, say, an American citizen who has no form of health insurance at all, and he's earning some money. The money he has and will pay to a doctor if he goes to a doctor, that money has already been taxed. So it's taxed initially, and he's no tax favor. He's not in the least tax favored. Okay, another advantage of HSAs is you can take your account with its unspent HSA money to your next job, or even right on to retirement and use it some way then. So what this accomplishes is it divorces a source of healthcare money for you to help pay for your health care, divorces that from employment altogether. And doing that has many advantages. Like if your health care in the United States were completely divorced from employment, then if you're an employee at IBM and you have a great idea to start a new business, you could, I'm sorry, you could take this HSA money and you'd still have it, and you could start a new venture, a new type of business because you had a great idea. And that should say HSA scheme. So the question is the HSA scheme the best way to divorce health access from employment? Given that you are in a high deductible plan, and of course, if you're chronically ill, your feelings about the HSA idea may be very different from the feelings that a wealthy person who's relatively healthy may have. So we'll give two examples that we'll discuss in the upcoming session. One is a 32-year-old married couple. They met working in a company where Sarah assisted the accountant. Sam works there as a warehouse worker. Sarah just learned that she's 8 weeks pregnant, which would be their first child. Their total household income is $40,000. They have $6,000 saved, which they wanted to hold on to in savings in case of an emergency. Their employer pays 80% of a high deductible policy and also put $1,000 into a health savings account that he encouraged them to set up, which they did. Obviously, if he's going to give them $1,000 for their health savings account, they're going to want that. So they set up the account, But after paying 20% of the premium for their high deductible plan, and they couldn't afford to add to the HSA. So they had $1,000 in it for each of them. So $2,000. And after she had her first ultrasound during her pregnancy, there was actually no money left in the HSA. Later in the year, Sam developed some bad respiratory symptoms and thought of going to the doctor, but he didn't go because they don't have much money and he wasn't that sick. So the question is, how much money will likely be in their HSA after 10 years? And how much will they have saved on their tax liability over 10 years? We'll discuss this in this session. The other example is Austin, a 32-year-old Princeton grad who was very effective at choosing the right parents, inherited a lot of money, and he's now a junior partner in a private equity firm, and his task is to scout out suitable investments. And despite using every available tax avoidance strategy, he does end up in the 37% tax bracket, sets up an HSA, places the maximum into it, $4,400 each year, and over 10 years, he's got 44,000 that he's contributed to it. And despite a few annual health visits, a sprained ankle, and a few other things, after 3 years, he has $17,000 in it. And at that point, his accountant complimented him for setting up the account, which is a brokerage account invested in stock market. After 10 years, if he play, after 10 years, his investment advisor and his accountant said he'd likely have more than $90,000 in that account, which he would only have contributed 44,000 to. And none of that money has been and may never be taxed. And over the 10 years, he's going to save thousands of dollars on tax payments. So how well is this policy of having high deductible plans with HSAs? How much is it helping this fellow? So anyway, those are the two cases we're going to discuss during the upcoming session, and I will cut it off right there. So thank you all for your attention, and take care.